My name's Liz and I work as a psychological therapist in the Wellbeing Service, and I've been working as a therapist using cognitive behaviour therapy for the last 5 years with the work I'm doing, and mostly on a one-to-one basis. So today I'm going to be talking to you to try and just give an introduction to what CBT is, the sort of approach it's using to try and help manage problems of mood, anxiety, emotional difficulties. And I hope it's going to come across as well that it's a therapy that I am really enthusiastic about, and I think is a really positive approach to managing problems. And do bear with me because I'm quite nervous about this myself, because I've not done a talk in front of a group before. I'm usually doing this on a one-to-one basis, so the technology might fail me as well, so bear with me. Okay. Right. So what we're going to be looking at today is just a really quick introduction to some of the important principles of a cognitive behaviour therapy approach, and a very quick look at what the application of CBT is for sort of general treatment of mood and anxiety problems, and also hopefully starting you thinking about how a cognitive behaviour therapy approach can be applied in our day-to-day lives, and that's something that we think is really important in the service, so it's going right from that level upwards really. Okay. So just a very quick little bit about the sort of background. So an important aspect of cognitive behaviour therapy that is really stressed is that it's an evidence-based approach. So the sort of information, the work we're using, it's all based on research that has a really good evidence base that supports why that is useful, why we're doing it in that way. Okay. It's one of the treatments that's in the NICE guidelines for many types of psychological and emotional problems. We're going to be today just thinking very generally about low mood anxiety, but it's also a recommended treatment for specific anxiety mood problems such as panic disorder or social anxiety, obsessive compulsive disorder, and linking in with what our speaker was just saying, post-traumatic stress disorder is something that's recommended and can be quite effective as a treatment for as well, and that's something that we're seeing more and more coming into our service. It's also a therapy that is continuing to develop all the time. It seems to be growing and spreading all the time at the moment. It started off very much as an individual therapy, but it's now being used as an approach so that people can use it themselves, very much sort of self-help approach. But it's also developing in other ways. And I noticed later on today there's a speaker talking about mindfulness, and within CBT some mindfulness principles are being incorporated into the therapy approach as well. What is it really? What I really value about it is I think it's a very practical talking and behaviour therapy. It's a very practical approach to trying to manage difficulties with emotions and sort of day-to-day problems really, as well as more complex difficulties. It uses a very structured approach as well, which can be helpful. So the cognitive bit refers to our thoughts, what's going on in here. You know, the thoughts we have and the meanings that we give to the experiences that we're having all the time. It's also, the behaviour bit is a very important part of cognitive behaviour therapy. It's like an active therapy, it's a doing therapy. So although it's classed as a talking therapy, I always think it's a talking and doing therapy. And I think the therapy bit really is the bit it's about making change. If we are going to carry on doing things exactly the way we're doing them at the moment, how are we going to improve? How are we going to be able to cope better? So it is about actually looking at what needs to change, and that might be in a very small way or it might be in very big ways. Okay. And cognitive behaviour therapy works from the idea that our emotions and behaviours are influenced by the way that we see things, and the way that we think about them, and that's something that we come back to again and again and again. Okay. So an example of what I'm meaning there is, say we could have 10 people, well, we've got more than 10 people today sitting in this room. We aren't all going to be seeing this in the same way. We're all going to be thinking about it in different ways. We're all going to be feeling different emotions, you know, and that's going to have been influenced by the experiences that we've had through our lives, the situations that we're in at the moment, what's happened this morning before we got here, you know, what happened last night, what we think we're going to be doing later on. All those things are going to be having an impact all the time on the way we see the situation that we're in at the immediate time. I'm going to go on to think about that a little bit more clearly, using an example, and we get to see my dreadful drawing here. So it's an example to try and illustrate that, and also start to look at the way a cognitive behaviour therapy approach structures things. We're going to take the example of Bill and Ted. So Bill and Ted are both in a lift. Say they're in St Peter's Court in Lowestoft. They're heading up in the lift, and the lift stops between floors. Okay? They're both in exactly the same situation, but this is what Bill looks like, and this is what Ted looks like. So let's have a think about what's going on, because as I said, they're both in the same situation, but it looks like something different that's going on for both of them in that same situation. So first of all, let's have a look at Bill. So Bill looks fairly calm. He looks reasonably happy, actually. Doesn't look too concerned by this situation. So what sort of thoughts might be going through Bill's mind in that situation? We said he's feeling fairly calm. Yeah, fairly relaxed. Okay. So what might be going through his head at that point? Anybody got any ideas?
You might be thinking, oh crikey, the lift is broken down again.
Yeah.
Happens all the time.
Yeah.
Instantly it's thought.
Yeah.
You might be thinking, oh, the lift's broken down, great. I'm
Yeah.
on a day off work.
It's work time, isn't it?
Yeah.
No, I didn't say. I'm sitting here and eating a bag of crisps. And,
Yeah. Yeah.
He's thinking there's not really any danger.
Yeah. 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 So I bet you can't read that writing at all, can you, for where you sat? I just realised. So these are his thoughts. He's feeling calm and relaxed. We can see that from how he looks. And these might be some of the things going through his mind. This is how he's seeing that situation. So his behaviour is going to be, you know, a result of what he's thinking and what he's feeling. So he might be, what might he do? Get his phone out and start playing on his phone. Pass the time away. What else might we see in his behaviour?
Might just sit down on the floor and
Yeah.
have a rest.
Yeah. Yeah.
Try to strike up a conversation with Ted.
Hopefully, yes, because poor Ted looks like he needs it. Yeah. Yeah. Okay. So, Ted. Poor Ted. He looks in a bit of a state, doesn't he? So, how do we think Ted could be feeling this situation? What's his expression telling us about how he might be feeling?
And he hates heights as well.
Yeah, so one of the things is, I hate heights. That might be a thought going through his mind. Yeah.
Hates small spaces.
So,
Hates small spaces.
yeah. I hate heights, small
Oh
spaces.
God, I've got a car parked in the car.
Yes, yes.
yeah, how long am I going to be in here?
Yeah. You might have experienced it before and it was
Yeah.
a traumatic experience. So.
Yeah, it was
Or
awful.
something similar.
It was awful before.
You might have been on the way to the loo.
Yeah. Yeah. Exactly, yeah. I need the loo. Yeah. And he looks like he's feeling really quite anxious. Yeah. It might be more. He might be feeling really frightened. Yeah.
And that might include physical
Yeah.
feelings as
Yeah.
well.
So what sort of physical feelings might go along with that? I mean,
Like sweating.
sweating, yeah.
Palpitations, it could be, you know,
Palpitations,
I mean,
yeah.
If he's really frightened and anxious.
Yeah. Breathing, even breathing might increase. His mouth might go dry. Yeah. So we've got completely different reactions. And what might he be doing, poor Ted? What sort of behaviour might go along with those sorts of thoughts and feelings? Yeah, he might be pacing around. Yeah.
Pressing all the buttons on the lift.
Pressing every button.
Swearing.
Yeah. Yeah.
He could be panicking and
Yeah.
quite irrational behaviour also.
Yeah.
Someone
Panicking.
might be losing feelings as well.
Yeah.
It could be a behavioural thing.
Yeah. Yeah. So what we can see here is, you know, just really illustrating that example that their reaction isn't just about the situation they're in. It's mostly about how they see that situation, and how they're seeing it is the result of their experiences that they've had before. Okay. And we've got here, we're starting to look at, there's a cycle here going on. That those thoughts are feeding the emotions, and those thoughts and feelings are driving the behaviour that in that situation. And there isn't really anything in this sort of behaviour or the way he's thinking at the moment that's sort of going to calm him down or get him out of that. He's sort of stuck in that pattern just there and then in that moment. Whereas Bill is hopefully now going to step in and try and help him manage some of this, if he's a kind chap. Okay. So we've got that example there of that principle of our emotions and behaviours being influenced by the way we see things. Yeah. But so why don't we all think the same way? That's probably far too big a question to go into now, but we do know that, as we were saying, our thoughts are influenced by our life experiences, the habits we've developed, the current situations that we're in, the attention we pay to different things in our lives. They're all going to have an influence on the way we're thinking. But we're looking here at, this is a sort of example that it looks at that thought, feeling, behaviour link that we're always looking at in cognitive behaviour therapy, and using that to try and look at what's going on, understand what's happening, and identify where changes might be usefully made. So an example of that sort of pattern with anxiety, the sort of thoughts, the anxious thoughts, all the what ifs, what if this happens, what if that goes wrong, the thoughts about their ability to cope, I won't be able to manage, I might panic or something, I might make a mistake, and those critical thoughts. The feelings that go with that are that anxiety, worry, fear, as we've just seen with Ted, and those physical reactions, as you were mentioning as well, that will go along with that, which are really important for us to be able to understand and make sense of. And then it's the different behaviours that might go along. So it's, we might avoid things if we're worried about them. We might be taking medications for anxiety. Sometimes that's helpful, sometimes it helps you get through a particular phase, but in the long run, does it help to change our ability to cope day to day? That's another thing to look at. We might just continually seek reassurance if we're anxious, or run away from situations if we start to feel that panic and anxiety. So we've done an example with Ted of his sort of anxiety. I was thinking about this when I was sort of trying to prepare this talk, and realised that I was pacing around my kitchen at home, completely distracted, in my head all thinking, right, what am I going to include, how am I going to do this? And I realised I was actually really feeling quite stressed and anxious about it myself. And the sort of thoughts that were going through my mind were, it won't be any good, I might mess it up, I might be too nervous to speak, but I'm managing to do that at the moment, so that's not happened. I might feel silly and embarrassed because it's something I'm not used to. What I noticed first was these feelings, that I was tense, that I was nervous, I was worrying, and that I was sort of breathing a bit faster. I was getting that sort of physical reaction to those thoughts. And the behaviour, well, there and then tried to put off thinking about it, kept looking for lots of reassurance from colleagues that it won't be a disaster, pacing around, yeah. And in the long term, trying to avoid speaking in front of lots of people. You know, if we don't have to do it, not many people really love it, although one of my colleagues said I'd love to do it. So we've talked about anxiety, and this is an example of a more sort of depressive pattern. And think of it, well, I was thinking of a situation, something typical. So it may be that someone's expecting a friend to call, and they don't call when they said they were going to, or when they expected them to. And if you're already feeling quite low or quite down, or, you know, things are a bit tough, the sort of thoughts that might start coming in, you know, I must have done something wrong. They don't like me. I'll never have good friends again. It's sort of rolling into some really negative thoughts there. But the important thing as well that we want to look at is that thoughts aren't facts. And we often get caught up into thinking if we think something, that's the way it is. And, you know, we do that all the time. But thoughts usually very often aren't facts. They are just fleeting thoughts. The feelings that go with that sort of depressive pattern, feeling upset, feeling down, disappointed, tired but not being able to sleep, so that again those sort of emotional feelings but also the physical feelings. And the behaviours that we might get caught up in when we're feeling down and low. You know, it might be, in this example, staying in and avoiding company of other people around. Maybe avoiding a friend in the future, thinking, you know, I must have done something wrong, maybe they don't like me. And spending the evening doing nothing, except what they might have ended up spending the evening doing is worrying and going over and over it in their mind. So that's an example of that sort of depressive pattern. So with using cognitive behaviour therapy, we're trying to use that structured approach to identify the problem areas, to look at what's going on at the moment, and to try and identify where we could make changes that are going to help us develop better patterns of thinking, feeling and behaviour. I think one of the things that is important that we recognise is that we can't not have thoughts. We can't stop thinking something because our brains don't sort of work like that. But what we're looking at doing using this approach is trying to develop ways to manage those thoughts better. And cognitive behaviour therapy can work on very different levels of input, and I mentioned earlier when I sort of touched on the fact that it started off as an individual therapy, but actually the information, the approach has been sort of used a lot more widely, and now there's an awful lot of really good information that we can all access and just use ourselves without any input from anybody else. There's a lot of I've included a slide at the end that's got some websites, some books and that we can all access and use. And there are many, I've included that. And there's also the sort of guided self-help, so courses that are run around and run from our wellbeing service as well, such as a stress control course. That there's some online guided help courses available now. And one-to-one sessions with a therapist to look at doing that more sort of day-to-day level stuff as well. But there's also then, if that isn't sort of enough to manage maybe more complex or longer term problems, it may be that individual therapy in a more structured session might be helpful. So you can spend more time looking very specifically with somebody to support you through that step by step. And cognitive behaviour therapy is a very shared therapy, it's a very collaborative therapy. It really is about you working with the therapist or the practitioners to try and manage the problems. So working with thoughts. one of the important bits with that is, first of all, identifying those thoughts, noticing those thoughts, and being able to notice them a little bit more clearly, so we can start to do some work with them. And one of the things that, you know, people might be suggested that you do is start to write those thoughts down, trying to use maybe a thought record to notice what was it that was popping into my mind then? What was it, you know, when I started feeling upset then, what was going through my mind? And trying to get a clear understanding of that. So one of the things that we might want to do is sort of challenge those thoughts. So I was saying before, we often seem to get caught up in the idea that thoughts are fact. If we're thinking it, that's the way it is. But very often they're not. So it's looking at, what's another way of looking at this? What does the evidence tell us? Sometimes I think people have got caught up in the idea that cognitive behaviour therapy is about thinking positively. It's looking on the bright side. And maybe in a way it is, but it's actually looking at the reality, looking at the facts rather than the way we're feeling about it. Looking at the thinking styles that we use. You know, we have styles of thinking. There are sort of patterns in the way people think, and some of the ways of thinking can be quite unhelpful. So identifying those thinking styles and seeing if maybe we're getting caught up in unhelpful ones can be really useful. So, for example, do we tend to filter out? Do we just tend to notice the stuff that fits in with how we're feeling at that time? So, for example, we say somebody makes a comment on someone's appearance, and you know, it might be, oh, you put a bit of weight on, or you know, do you need to get your hair cut? I don't know, that's a bad example, but we have a tendency to home in on that critical, maybe slightly critical comment. It might have been very well meant, it might not have been meant critically, but we sort of get caught up in homing in on that critical comment, and we ignore the fact that actually 10 other people have told us how well we look, or that person has also said some really nice things about us, or some really complimentary things. We just home in on that negative one. So that's an example of sort of filtering out all the other information. Mind reading's another one that we can get caught up in. So we might be thinking, an example of that is like, oh, you know, everybody thinks I got that wrong, or everybody must think I'm stupid, or that person's thinking this about me. You know, we don't know. You know, we're guessing there. We actually have no idea what they're thinking. It might, you know, we might get an idea by their facial expression or their behaviour, but often we're just guessing at what they're thinking. And what we're guessing is probably fitting more in with how we're feeling at that time than what the evidence tells us they might be thinking if we really look at it. And another example of a thinking style is that catastrophising. You know, if we went back to that sort of negative cycle, the sort of catastrophising again. So it goes from, have I done something wrong in this situation? You know, maybe they don't like me, to I'll never have good friends again. A really good example of catastrophising from one incident and predicting how dreadful it's going to be always in the future. One of the things that we might look at trying to do using this approach is about managing those thoughts. We've looked at identifying the thoughts, recognising styles and patterns of thoughts, and then it's about how do we start to balance those thoughts, to manage those thoughts. So it's trying then to sort of step back and think, is there another way to look at this? Is there another perspective? What do the facts tell me? And how would I advise someone else in that situation? That's sometimes a good one to use, because it's, you know, we are often kinder to other people than we are to ourselves. So that's always a good question to ask yourself. So moving on to an example of that working with thoughts in practice. So you know, Jane's been feeling stressed, feeling low in mood. She's not been feeling well for some time. She wants to try and tidy her kitchen because she thinks it's getting out of hand. She wants to try and get on top of things again. And she starts washing up and breaks a plate. immediately she's thinking, I'm useless, I can't even do that right, it's a disaster, there's no point doing anything. So again, we can see Jane's catastrophising. The facts are, when she's able to step back and look at them, that it wasn't a special plate, she does have others, and it was an accident, it was simply an accident. She may also be filtering out as well, recognising that actually the 2,000 other times she's washed up and not broken a plate, that was fine. And it may be that other family members have broken things but don't beat themselves up about it, and she wouldn't beat them up about it either. So it's just recognising those tendencies. So looking at the facts about our reactions. So really, we looked before and we mentioned the panicky feelings and how we might have physical feelings of panic as well as emotional feelings. And a really important part of understanding and trying to manage anxiety better is really understanding what of those physical reactions are, because they feel very threatening and they feel very frightening. But actually, we'd really want to look at what does the science tell us those feelings are, because they are a normal reaction to being stressed. But we often think they mean that there's something terrible going on with us, that we're having a heart attack or we're ill or something dreadful is going to happen. So understanding, getting that knowledge, getting that understanding better might be really important. So that's with anxiety. But another aspect is the slowing down that we might get with depression as well, and understanding and recognising that and what has an impact on it. So working with feelings, learning techniques to manage the physical and emotional stress can be really useful. And using things such as the relaxed breathing, that progressive muscle relaxation, and mindful meditation practices and exercises can all be helpful in trying to manage those general stress feelings. Developing an understanding and awareness of our emotions, so we're better at noticing sooner before we've sort of plunged into that really low feeling or we've really got panicked. And also noticing what are the triggers, are there typical things that are triggering those emotional responses. Working with behaviour is the other aspect of this. We've done the thoughts, we've done the feelings, and now we're going on to look at the behaviour, the doing bit of CBT. So looking at the patterns of behaviour, recognising those behaviours which are helpful and those that are unhelpful. We might do that by keeping a record of activities, noticing what effect our activities has on our mood there and then. So often a starting point in working with trying to manage depression is really looking at the day-to-day activities, looking at what's changed, looking at how doing those activities makes us feel, and looking at where we can start to make the smallest change to get the biggest effect on how we're feeling. So for example, it might be what we do tend to do when we're feeling low, as we mentioned in the previous examples, was that we tend to do less. And the problem is the less we do, the less opportunity we have to experience any sort of positive feelings, and the more time we have to get caught up in all those depressed, negative, sort of critical thoughts. So actually increasing the activity and noticing the difference, how we feel before we start doing something and when we've done it, can be really useful to give you that confidence to just keep having a go. And I've mentioned there about using activity and exercise to combat low mood. I think one really good thing with that is this what we call 5-minute rule. So when we're feeling low, it is really difficult to motivate ourselves, and it can be day to day anyway, getting started on things. We just get really daunted, we get those what's the point thoughts, okay? But if we try and break it down to something that might be a lot more achievable, once we get going on it, we often find that we can carry on and we can keep going with it. So, for a really practical example, if you're sitting there and you've got a pile of ironing up to there and you're thinking, I've got to do that ironing, it's really daunting to start thinking, I've got to get it all done. But if we set the task of, actually, I only have to do it for 5 minutes, all I have to do is 5 minutes worth of that ironing, you're a lot more likely to get started on it because it's less daunting. And what often happens is once you're doing it, you can carry on doing it. You're starting to feel a little bit better. You feel pleased that you've started. That's an achievement. You know, so it's capitalising on that, using it to keep going and go further. Working on longer term problems. So CBT focuses very much on the here and now, the current situation that we're in. And that's usually going to be the best starting point, and usually is all we're needing to look at. But sometimes for longer standing or recurrent problems, this is where sort of individual therapy or small group therapy might be useful. And within that, we might be spending more time just having a look at understanding and focusing on the past experiences that help us make sense of patterns of thoughts and feelings in the present day. So it might be really important if you're hitting up against a recurrent problem to identify what those more deeply held beliefs that you have about yourself and the world are that are having an impact on the way you're seeing things in the day-to-day. And the work, you might be doing some work then focused on managing those deeply held beliefs better. It might be that you want to strengthen some more helpful, positive beliefs about yourself that are going to help you develop better ways of coping. So I think I've got an example of that, but I think I should stop there because I'm not sure on the time.